Vasovagal syncope. Vasovagal syncope happens when your body's normal ability to control blood pressure doesn't work like it should, causing you to pass out. Vasovagal syncope is the most common type of reflex syncope, which happens automatically for reasons you can't control. Vasovagal syncope is the most common type of reflex syncope, which happens automatically for reasons you can't control. It's also sometimes called neurocardiogenic syncope because it's caused by factors involving the heart, brain or both. Who is at risk for vasovagal syncope? 1 out of 3 people will experience vasovagal syncope at least once in their life, and it can happen to people of all age groups. In people under 40, vasovagal syncope causes about 85% of all passing out or fainting instances. In older adults, it makes up about half of those cases. People with disorders that affect their autonomic nervous system, such as Parkinson's disease, are extremely unlikely to have vasovagal syncope. That's because their condition disrupts the normal functions of their nervous system. What causes vasovagal syncope? Vasovagal syncope is a reflex reaction to something happening around you, but the reflex is either too strong or happens at the wrong time. This all starts in your nervous system. Part of your nervous system works without you having to think about it. This is called your autonomic nervous system, and it has 2 main subsystems. This controls your fight or flight response. This is all about speed, reflexes, strength and preserving your safety. When your sympathetic nervous system is active, your heart rate and blood pressure go up and you are ready for quick action. This controls your rest and digest response. It's focused on non-emergency processes, including eating, digesting and other bodily functions. It's sometimes called the feed and breed response because it's also active during sexual arousal. One of the key nerves in this system is the vagus nerve, which controls your heart and blood pressure. Under normal circumstances, these 2 systems balance each other out. That balancing act involves reflexes that your body develops. Think of these reflexes like a computer program that tells different systems in your body, if this happens, then you should do this. If your vagus nerve becomes too active, it can cause your heart rate and blood pressure to drop too much or too fast, or both. If your blood pressure drops too much, this causes an attack of vasovagal syncope, and you pass out because there's not enough blood flow to your brain. What does it feel or look like to have vasovagal syncope? Common symptoms that happen about 30 to 60 seconds before an attack include lightheadedness, dizziness or nausea, a sudden wave of heat, or warm feeling, pale skin, a sudden feeling of tiredness, yawning, profuse sweating, slow pulse. Once an attack starts, the following are likely to happen: loss of consciousness and falling to the ground, usually for no more than 15 seconds. Eyes remain open but roll up and back into your head. Twitching movements, which can sometimes be mistaken for a seizure. Loss of bladder control. No interruption in breathing, which can happen with life-threatening conditions. Once you come to, you'll usually recover quickly, in about 20 to 30 seconds. Disorientation or confusion either doesn't happen or they don't last longer than 30 seconds. The following may also occur: anxiety or nervousness, dizziness, headache, nausea, pale skin, sweating, urge to use the bathroom. Another attack of syncope, especially if you stand within 30 minutes of the first attack. Common triggers that cause this condition: vasovagal syncope is almost always triggered by something happening to you or around you. Common triggers include needles or medical instruments. Vasovagal syncope is usually what causes people to faint when they have blood drawn or when they donate blood. Some people also pass out at the sight of certain medical tools or instruments, such as scalpels. Seeing blood. Fainting at the sight of blood is also a common cause of vasovagal syncope. Stress, anxiety or emotional upset. Strong emotions, especially overwhelming ones, can cause a person to pass out from vasovagal syncope. Fatigue or exhaustion. Overexertion, even just from standing too long, can be enough to cause a person to pass out. Two main types of reflex syncope are similar to vasovagal syncope. The main difference is the causes are easier to identify. Carotid sinus syndrome. This is more common in men over age 50. This reflex causes you to pass out when there is pressure on your neck. It can happen while shaving, wearing a tight collar, or turning your neck a certain way. Situational syncope. This group includes reflex syncope that's predictable and happens during certain activities or situations. A few examples of situational syncope are passing out when urinating, having a bowel movement, coughing, swallowing, or after a meal.